In the last lesson, we saw why Medicare was created to cover older adults. Now we'll look at Medicaid and why income, not age, became the focus of this program. Even with employer-based insurance and Medicare, millions of Americans still lacked access to health care. Low-income individuals and families often worked jobs without benefits, couldn't afford private insurance, relied on charity care, or delayed treatment. Healthcare access increasingly depended on employment and income, not medical need. Medicaid was created as a joint federal-state program to address this gap. The federal government sets broad rules, but states control eligibility, benefits, administration. This allowed flexibility, but also created variation. As a result, Medicaid coverage looks very different depending on where someone lives. Medicaid expanded access to care for millions, especially children, pregnant women, people with disabilities, and those needing long-term care. But it also introduced complexity and uneven access. Coverage exists, but consistency does not. Together, Medicare and Medicaid filled critical gaps left by employer-based insurance, but they did so by adding new layers to the system. In the next lesson, we'll look at what happened when rising costs forced insurers and employers to focus on cost control through managed care.